So for massage strokes, the first one is a flourish. There's superficial, deep, or fast. The deep is used to promote fluids out. Superficial is promoting relaxation, and then fast is to encourage blood flow. Those two techniques are basic in shingling. So the basic is you go up, down adhesion, and go back. Then shingling was if you do one first up, go back, and then do the other one. Next is friction massage, which is used to stimulate the body's natural healing process and separating tissue breaks that up. So it can be seen like this, where you're just doing circular strokes here. For neuromuscular techniques, this is ischemic compressions, where you are basically just triggering or putting your thumb on that trigger point. You want to hold it for about 30 to 90 seconds. You could use a thumb or your elbow, but you want to make sure that their pain is not getting over a 7 or 8. The next one you would do is sports massage, which combines a flourish, peach massage, friction, and the massage. You would just keep massaging, but for 30 minutes you would want to keep increasing your intensity. And you can also do what's called muscle striping, which is when you stroke from your insertion to your origin. So just continually going down like this and going up. So peach massage is used for stretching, separating the muscle fiber and fascia. So you would basically lift the tissue up and knead it and roll it, and just really separating those layers. Myofascial massage combines a flourish, peach massage, friction with stretching the muscle and the fascia. So you can do this by J stroking, which is when you would hold that adhesion and just form a J off of it, and just holding that until you feel a relaxation, which usually occurs in 90 to 120 seconds. You can also form focus stretching, where you cross your hands and stretch like this. You can also do skin rolling, where you start inferior or lateral to that adhesion, pull the skin and roll them with your thumb and fingers. You can also do a form of traction, where you pull the opposite arm, opposite leg. Oh, just kidding. This one is when you would have the arm adducted here, feeling the adhesion, and you would just pull while massaging here. You can increase the adduction just so you feel the adhesion relax. Diagonal release is the traction where you would feel your adhesions release. Vibration is when you would be used for increasing blood flow, and this is basically it'd be like a whole shaking thing. And then tapement is used to relaxation and desensitization of the skins. So this is where you're just feeling and just tapping it. For manual cervical traction, this could be sustained or intermittent. This is beneficial for the patient who may not do well with mechanical traction or may require a different angle of pull or is sensitive to the tension. So it's really helpful when the clinician is there and able to apply what is best fitted for the patient. So to do this, you would have them down and you would put your hands on the base of the occipital bone and just pull up, or you can do it with one hand and then have the other hand on the forehead, but you don't want to pull from the jaw as that could cause jaw problems with your TMJ. The unique traction technique I found is called positional traction. This form is used by placing different pillows or towels and putting the patient in different positions to cause an effect on those longitudinal structures of the spine. This is usually for 5 to 10 minutes, and it really causes reduction of those symptoms and can also be something that they can use at home. So to start, I'm gonna have you face that way. I'm gonna put this towel under your iliac crest here. And then I'm gonna have you rotate back on the shoulder. You might want to scoot up a little bit. On the shoulder, rotate back, but then bend your knee up like this. How does that feel right there? Just stretching. And you would just hold that for 5 to 10 minutes. And this one's really nice because they can do it at their home and they don't need to be around a clinician once they know how it feels. This is manual lumbar traction, usually applied with a clinician's body weight and the use of a belt. The level of tension has to be a lot higher than you would use in cervical traction. Over 90% increase between the intervertebral separation is found within the first 15 minutes. To target specific regions in your lumbar spine, you flex the hips 45 to 60 degrees if you're targeting L5 to S1. 70 to 60 is found L4 to L5, and flex the hips 75 to 90 degrees if you want to target L3 and L5. Usually this harness right here is required when using lumbar traction, just so you can stabilize the patient to the table. So to demonstrate this, you can start with their knees being bent. If you want to isolate the hips if they've had any hip fractures, but this is my nice belt here, and you would go around here and it would all like go around behind me, and then you would just have some tension here. And like I said, it requires a lot more tension than in the cervical spine. You can also do it with your legs bent, straight. And again, flexing those hips where you need it to be to target those specific lumbar regions.